Good morning. Throughout the 2008 presidential campaign, we saw healthcare in the United States become an issue of rising importance. Rising healthcare costs and the potential for 45 million Americans to become uninsured only fueled the fire of the debate. Presidential candidates and senators at the time, Hillary Clinton and Barack Obama, had two different visions for healthcare reform in the United States. Senator Clinton's vision included a public option or an individual mandate to purchase health insurance, whereas Senator Obama's did not, according to cspan.com. However, we would come to find later on that both of their visions for healthcare reform in the United States weren't so different after all. I plan to discuss with you today the history of the Patient Protection and Affordable Care Act legislation, the facts behind its inaction, and what it means for America today and in the future. Now, according to Wikipedia.com, after President Obama was elected, a joint session of Congress was called in February of 2009. There, President Obama announced that he would begin working on a healthcare reform plan for the United States. The president officially and formally began the construction process on March 5th of 2009. From June until the congressional recess of 2009 in October, a series of 31 hearings were held amongst senators, such as Max Baucus of Montana, Chuck Grassley of Iowa, Olympia Snowe of Maine, and Kent Conrad of North Dakota, among others. During the congressional recesses, politicians raced back to their districts to take the pulse of their constituents and their views on healthcare reform in the United States. Now, during the summer recess period, we began to see the rise of the Tea Party movement. Many conservative and constitutionalist groups began galvanizing at town hall meetings with these politicians all across America and expressing their dissatisfaction for a prospective individual mandate on health insurance. We also saw Washington become a meeting ground for lobbyists in secret meetings behind closed doors, away from the cameras of C-SPAN. These secret meetings were officially denied, but according to the Sunlight Foundation, they did actually take place. The foundation documented many meetings between healthcare lobbyists and politicians on both sides of the aisle. After the recess, President Obama once again gave a speech to a joint session of Congress outlining his proposals and his support for healthcare reform. Also at this time, President Obama supported publicly a health insurance mandate, which he previously had opposed during the presidential campaign, but oddly enough had supported as a state senator before his presidential run. Now, on November 7, 2009, the Congress passed the first version of the healthcare reform package entitled the Affordable Care Act for America. The Senate then failed to take the bill to the floor, but later amended a different bill to include the provisions of the debated Health Care Act. Passage of this amended bill was filibustered at first by Nebraska Senator Ben Nelson. Nelson temporarily sided with the Republican minority until his state was awarded an amendment in the bill for a higher rate of Medicare reimbursement in the state of Nebraska. This is what the Las Vegas Sun, the FoxNews.com, and ABCNews.com have reported as the Cornhusker kickback. A vote was later passed to end debate on the bill for the time being in order to avoid a further filibuster by the minority of Republicans. After further discussion and debate, the President supported the passage of healthcare reform by taking pieces of all the earlier bills and amending them through the reconciliation process. Initially, after this, the bill could not get enough Democratic support due to the bill including federal funding for abortions, which obviously this piece of legislation did not set well with pro-life Democrats. The President later promised to issue an executive order barring the use of certain federal funds for abortions. After this concession was made, the amended and reconciled Patient Protection and Affordable Care Act was passed by a vote of 219 to 212 on March 21st of 2010. President Obama signed the bill into law 2 days later. Now, here are some of the facts of the bill, the impact of the bill in the United States today and going forward. This is from the CBO, the Congressional Budget Office, In this year of 2012, the CBO projected the act will require more than $1 trillion of gross federal spending over the period of 2012 to 2022. Some of which will be offset by penalties and tax increases related to coverage, resulting in net spending, however, of more than $1.2 trillion, while the act was estimated to cost only $940 billion. The CBO also estimates that by 2019, 30 million people will be insured, but still leave a prospective 19 million uninsured, who are otherwise eligible for the benefits. There is still a health insurance mandate, or a public option, even though the president said that if you liked your insurance, you could keep it. According also to the state of New Mexico, federal funds were still being used for abortions after the enactment of the health care law in 2011. In the bill, there is also a contraceptive coverage mandate, effective in August of this year. It controversially applies to religious organizations such as Catholic universities, hospitals, charities, and other organizations that hold a moral and contentious objection to the use of contraceptives. As of today, children can stay on their parents' health insurance plans until the age of 26, and insurance companies cannot deny a child under the age of 19 coverage due to a pre-existing condition. Now, effective 2011, Medicare provides 10% bonus payments to primary care physicians and general surgeons. Medicare will cover the full cost of an annual wellness visit and personalized prevention plan services for beneficiaries. New health plans will be required to cover preventive services with little or no cost to patients. Also, an annual fee, worth noting, an annual fee is imposed on pharmaceutical companies according to market share. This fee, however, does not apply to companies with sales of $5 million or less. Effective 2012. New tax reporting changes are to come into effect to prevent tax evasion by corporations and individuals. However, in April 2011, President Obama signed a bill repealing this provision because it was burdensome to small businesses. Effective 2013, the threshold for claiming medical expenses on itemized tax returns is raised to 10% from 7.5% for income. However, the threshold remains at 7.5% for the elderly through 2016. Also, the FICA, the Federal Insurance Contributions Act tax, is raised to 2.35% from 1.45% for individuals earning more than $200,000 and married couples making more than $250,000. This tax is imposed on some investment income for that income group. Also, a 2.9% excise tax is imposed on the sale of all medical devices. Effective 2014, most people required to obtain health insurance will be required to obtain health insurance coverage or pay a tax if they don't. Healthcare plans can no longer exclude people from coverage due to any pre-existing condition. And health insurance companies will all begin paying a fee based on their market share. The greatest impact, perhaps, that by 2016, according to MIT economist John Gruber, who was one of the architects of Obamacare or the Patient Protection Act, according to Forbes.com, he claimed depending on what state you live in, healthcare costs, after all, will cost you the premiums will be raised from anywhere between 19 to 31%. Now, up to today, 25 different states have joined in challenges to the act in federal court. In March 2012, the case has reached the Supreme Court for arguments, in which the constitutionality of the law is expected to be decided shortly, maybe even within days. These are the facts of the healthcare debate in the United States, and next week we will get into the constitutional argument against Obamacare. Thank you for your time, and we'll see you next time.